Hi, this is Dr. Rodríguez-Feliz, board-certified plastic surgeon here in Gables, Florida. And the purpose of this video is to let you know of some of the guidelines that we have taken in our operating room to operate, actually do surgery in patients in the post-COVID-19 era. Every patient that I operate gets seen at about 2 weeks from the surgery, where we do a preoperative appointment where they sign the consents, and I also have a second opportunity to go over any concerns that they may have, questions about the procedure. At this time, we're going to take also a time to ask questions regarding symptoms for the COVID-19, including fevers, coughing, runny nose, difficulty breathing, and this is going to be performed at that window of 2 weeks pre-op. Then, ideally 5 to 7 days before the surgery, we're going to be performing an antibody testing for COVID-19 on every single patient that is going to have surgery. The reason of doing this 5 to 7 days is because it gives us some time for the results to arrive, and there will be a set of patients based on those results that will need to have actually a PCR testing to detect the actual virus. So we want to give ourselves some time to be able to take whatever measures that we have to take. During that week prior to the surgery, we're also going to ask the patients to limit the exposure to other people, and that way actually decreasing the chances of them getting infected. The day of surgery means no patients with symptoms will be operated. So every single patient has to be asymptomatic. If you present to your surgery and you're having coughing, any fever, difficulty breathing, your surgery will be canceled for your own safety and for the safety of everyone in the operating room. At this time also, there will be a consent that, of course, if we are okay in proceeding with surgery and the patient is asymptomatic, like we mentioned, then there will be an additional consent that has been created by the American Society of Plastic Surgeons, where it's going to be for the patient to basically confirm that they understand that this is an elective procedure, that they have been notifying and being honest in the notification of any possible symptoms, etc. And that will be performed or also done prior to surgery. During the surgical time, or the surgery per se, we're actually limiting the amount of patients that we're going to be operating to 1 patient per anesthesia machine. Therefore, in most cases, we're going to be performing either 1 or 2 cases a day. And also, lastly, the patients are going to be asked post-op to stay in some sort of self-quarantine for at least a week. In order to achieve this, we're actually going to perform our first immediate post-operative appointment virtually, which I like to perform within the first and the third day from the surgery, and we're going to bring the patients into the office actually at 1 week post-op for an actual evaluation. Of course, if there's any issues or any concerns, we'll be more than happy to bring the patient before that. But in doing this, we're going to try to limit the exposure that they will have to the outside. So these are some of the guidelines that we have incorporated into our operating room for all surgical patients undergoing elective surgery in the post-COVID-19 era. We have based this on CDC guidelines and our society, the American Society of Plastic Surgeons.